symphysis. It covers the pubic, from the pubic symphysis down to the perineal body. The same thing with compressor urethra. The uretrovaginal sphincter covers from the pubic symphysis down to the perineal body. It covers both the urethra and the vagina. While the deep transverse is under the superficial transverse. So let's continue. So we are now under the functions of the deep layer muscles, right?
Yes, ma'am.
They are mostly, they support the pelvic organs. We have pelvic organs, which are the bladder, the uterus, and the rectum. So they support these organs. They make sure that those organs are at the appropriate positions. So that's why once the peripheral muscles are weak and those organs might fall down, causing prolapse. You hear that someone is having cystocele, which is the prolapse of the bladder, uterine prolapse, and the rectocele, prolapse of the rectum. So their main function is support and postural stability. Okay. So these deep layer muscles, they have two types of muscle fibers. We have the 70% slow twitch muscle fibers and 30% fast twitch muscle fibers. And the 70% type 1 slow twitch muscle fibers, they maintain the muscle tone for a long period to sustain contraction and to provide postural stability. While the 30% type 2 fast twitch muscle fibers, they increase the muscle tone quickly for sudden increase in abdominal pressures during sneezing, coughing, lifting heavy objects, laughing, and all that. So the pubococcygeus muscles are also subdivided into two. We have the pubovisalis and puborectalis. And the pubovisalis is also divided into another 4 muscles. We have the pubouteralis from pubic to the urethra. Pubouteralis. We have puboperinealis from pubic bone to the perineal body, which is puboperinealis. We have a puboanalis from pubic bone to the anal region. We also have a pubovaginalis from pubic bone to the vagina. So all these muscles, when you now gather all of them, you now note that we have up to 15 muscles in female and 13 in male. In male, due to we have 2 openings in male, which is the urethra and the anus. So the ischiocavernosus and bulbocavernosus, they are now single. They are not paired. But in female, we have urethra, we have the vagina and the anus. So the muscles are now divided right and left to pave way for those openings at the middle part. So I want to ask you 1 or 2 questions, okay? If peripheral muscles are weak, what are the conditions, as in what are the conditions that your clients or your patients might come out with?
Urinary incontinence.
Yes.
Prolapse,
Yes.
pelvic floor muscle prolapse,
Erectile dysfunction.
Hmm?
Erectile dysfunction now.
Like name them now.
Like due to the because the
Yes,
issue.
erectile dysfunction. Yes, you're right. Yes, yes. Due to weakness of the ischio-cavernosus and the pubocavernosus. Yes, yes.
There will also be sexual dysfunction.
Yes.
Those that cannot reach to orgasm.
Yes, and the erection. Yes.
can also lead to pelvic weakness and alteration of gait.
Yes.
Inability to urinate due to the muscles being tight.
No, that one is tightness. I say weakness. If there is tightness now, the person will now be experiencing what we call dyspnea, vaginismus. Vaginismus, that is when you want to palpate the vagina area, maybe you are assessing, the person will be feeling pain due to tightness and there will be difficulty in penetrating. Then dyspnea is maybe during sexual intercourse, the person might start to feel pain before the intercourse or during the intercourse or after, and there will be difficulty in penetrating. We call it dyspnea. Even constipation due to tightness of the pelvic floor muscles. You might come up with constipation. Vaginismus, constipation, these are the conditions that might come out if the person is having tightness of the pelvic floor muscles.
Ma, I have a question. In vaginismus, the pelvic floor muscles are usually contracted.
Yes.
But in the physiotherapy management, if we give the exercises, are they not going to increase the tone of the muscles?
No, the exercises you are going to give, you are not going to be giving Kegels. You know, we are used to Kegels.
Yes.
If you are treating weak muscles, you do Kegels. Now you are going to do what we call reverse Kegels. That is relaxing the pelvic floor muscles with deep breathing exercises and postural. So you do also myofascial release. Myofascial release, reverse Kegels. And you can also use the eyes cryotherapy. You might crush eyes, put it inside either condom or hand gloves and place at the vagina area. Okay, before you start to do the myofascial release with clean lubricants like olive oil. Olive oil is okay. Any other question?
Yes, ma'am. If a patient is having okay, we've talked about constipation, the exercises for relaxation. So if a patient is having erectile dysfunction, what are we supposed to do for the patient as a physiotherapist?
In erectile dysfunction, it shows that the pelvic floor muscles are weak, but you need to assess and know what caused the erectile dysfunction, whether it's due to infection. The person needs to treat himself, you understand?
Yes, ma'am.
So you know the cause. Then during the assessment, if the pelvic floor muscle is also weak, you now stimulate the pelvic floor muscles. Okay? You now teach Kegels too. You teach Kegels, you stimulate, you can use anal probe to stimulate the stimulator that has anal probe to stimulate so that it will get to the deep muscles, okay?
Yes, ma'am.
Not only the superficial electro, you use the anal probe.
Thank you.
Any other questions? Okay, maybe let's call it a day. Tomorrow we will now think of another topic to teach.
Thank you.
Okay.
Ma, you don't have presentations for us.